I just want to say thanks, Dr. Oz, for coming out. He was interacting with patients and some of the staff over at the Federal Qualified Health Center. I got to thank you. Asking questions actually is an educational experience for me to learn more about what you do and what we need to do to improve outcomes here for people in the city. Of course, we are on a mission to transform the city from the perspective of creating more diversification, more opportunity, and we thank you for the visit because it's going to go a long way to helping us do that. So thanks for being here.
And I would echo the Senator's comments. It's incredibly impactful not only to have Dr. Oz here because of his current role, but it is more impactful that he is a physician who understands the challenges that the health system and the community faces. And what I witnessed today is somebody that is impassioned about healthcare, solving the problems that we have, and did an unbelievable job of really listening to not only our patients but our workers. Very inquisitive on the tour about the challenges we face. So I have never been more hopeful coming out of this to know that we have an advocate that's going to ask the tough questions and is going to drive the transformational change, and that is going to be tough, right? But at the end of the day, that's all we can ask is for somebody who understands the challenges and who's willing to work with us to get that done.
I actually am humbled because when I travel around the country, I've been to many places where there are underserved populations. And I took this job because I care about that population. Working at Columbia my whole life as a cardiac surgeon, my main focus was on folks, oftentimes in Spanish Harlem, which is where Columbia University is located. A lot of folks who are having difficulty doing some things in their life. And that emotional stress often led to physical illness, and then the whole system began to fall apart around them. So you come to communities where you see vulnerable populations, but you also see opportunity. Atlantic City's got tremendous geographic advantages, beautiful casinos, this facility, but you have a lot of people who are homeless. We drove by them. We went to places that boarded up, blocks after blocks that boarded up townhouses, and then we went to this beautiful little gem, this little miracle and an oasis of poverty, which was the Federally Qualified Health Center. And it is because of its physical location, the geographic center of where many folks live who are having trouble, their ability to get there seamlessly, and more importantly, when they get there, to see the light in the eyes of the providers who are there to help them, who have a passion for making sure they do better and understand, and I think this is instilled at every level of the organization. I'm going to applaud you for this. The ability to believe that what they do makes a difference. And so as you walk into the facility, there's a behavioral health area, there's a place for clinical care, and there's a PACE center, which I love because you're actually helping older folks to remain independent, remain at home, which is how most of us would like to spend our last years of life. There's a pharmacy, but mostly you have people who care a lot about each other. You have patients who know that and feel like they've got a home, a safe place. You know how petrifying it can be when you have an illness and you don't know what to do, and it's expensive sometimes, and you don't want to have to decide between groceries and your medications. But if you go to a place where they will actually push you and cajole you and send someone to get you to make sure that you come to a place where you're loved, and your inner beauty is appreciated, and folks finally actually begin to remember why life is so special, that's the kind of healing you want to have. I took this job because I care about the same issues that both of you care about. I took this job because, like many of you, I see a system that's broken. We spend twice as much on healthcare per capita in any other country. We're spending more on healthcare than we're growing our economy. There's many parts of the system that are broken, but I don't want to waste this crisis. I think we have a wonderful opportunity to address the underlying infrastructure challenges that our nation faces, and programs like this are shining examples of how we could do that well. So you're going to be reading and hearing a lot about the $50 billion Rural Transformation Fund. And I make sure I mention that wherever I go, because by the end of this year, we're going to deploy that money. And we want governors to apply for it, and we want them to wisely think about the places where they could use it the most. Is it manpower issue? Is it technology? So hospitals are in the 21st century with the way they interact with patients. Can we do a smarter job with the way we train physicians? You're building a medical school to train doctors. There's a nursing school here training 60 nurses a year already. There's so much more of that we need nationwide. Let's make this area an example of how others may find an opportunity when they may not have come up with the best ideas themselves. And by the way, there are ideas in other parts of the country that can be used here as well. And if we do this together, we'll lift all the boats because the tide's coming in.